God forbid, things were to turn in the wrong direction and spike, which we're not seeing that sign right now anywhere. Arizona's prepared.
That was Governor Ducey talking on Monday about reopening businesses in Arizona. At that time, there were 8,900 cases of coronavirus and 362 people had died. Fast forward to today, the day many businesses did reopen, and we are seeing a big jump in those numbers.
An additional 67 deaths were reported today. That is the biggest single-day increase yet. 517 people have died in Arizona so far, and we have more than 10,000 confirmed cases now.
Again, the spike in cases and deaths come as Arizona businesses start to reopen their doors. It has some people wondering if it's too soon to begin that process.
Now, the state will point to the number of hospitalizations, which shows that the numbers are headed in the right direction. But we dug deeper into the data and we found just the opposite. Heather Moore is joining us now live from home. And Heather, what did you learn about these numbers?
Well, Chris and Jared, we wanted to know, is the information the state putting forward an accurate reflection of where we are as a state health-wise? Well, the new hospitalization rate, that is the most important indicator. But health experts say right behind it is the number of people who are showing up in emergency rooms from coronavirus and also the number of patients being intubated. Those numbers, they're not dropping, not by a long shot. In fact, they have recently shot up. Take a look at the data from the past month. Since April 9th, the number of patients showing up at the ER with suspected or confirmed cases of coronavirus first plummeted sharply, but for the past few weeks, the trend is headed upwards. And if you look at just the past 3 days, the numbers shoot straight up, showing the highest number of people ever reported feeling sick enough with COVID-related symptoms to need to go to the ER, indicating an uptick in current infections. And if we take a look at another graphic here, this one shows the number of intubations, the patients who need a tube down their throat to breathe on a ventilator. These are the most serious patients, and those numbers are also higher than they've ever been. They were seeming to trend down, but they've shot up in the past week, especially in just this past couple of days, which is an indicator showing the severity of the disease. So when we're talking numbers here, we want to address that giant leap in new COVID-19 related deaths reported in Arizona today that you just mentioned. Well, health officials call the spike misleading, and they have a reason for it. Today's 67 new deaths is more than 3 times as many deaths as the worst day we've seen. That was April 20th when 21 deaths were reported. But here's the deal. State health officials are now using new federal guidelines to go back and track previous deaths over the past month or so that may have been the result of COVID-19 and reclassified them as such. This is called the death certificate surveillance. We are told 35 of the 67 new deaths reported today are from cases dating back to April 12th.
These were deaths that occurred earlier in the epidemic, and with some new federal guidance that came out earlier this month, the county health departments and it looks like the state health department have gone back and re-examined those death certificates and probably reclassified some deaths that may have been under a different classification, then moved that into COVID-19.
Oh, when you take the 35 reclassified deaths out of today's total, we're still at 32 deaths, which is, again, the highest number we've seen. But the number of deaths, according to experts, not as big of an indicator of where we stand in terms of being ready to open up and things really being on an overall downward trend. Now, we reached out to the governor's office to ask if he still believes opening the state is the best choice given these new numbers. They sent us this statement, not saying a whole lot here, but basically the governor's stay home, stay healthy, stay connected order is in place until at least May 15th. We're following the data closely and working with public health officials, and we'll have more updates next week. So at least May 15th may change. But that order, of course, put into place to flatten the curve and not overwhelm the hospitals. And as we start to see businesses open, people may be letting their guard down, not wearing their masks as much, not believing that things are as scary anymore. If the number of hospitalizations does jump back up, Jared, which may in fact happen, we don't know, state leaders at the very least know that we do have the capacity to handle it.
Yeah, we're all just hoping for the best. And Heather, I do want to mention our newsroom reached out to the governor's office and reached out to Dr. Kara Christ's office today asking for interviews about a number of issues, including the timing of the release of these new numbers today, and none of that ever materialized. Of course, we're happy to talk to them anytime they agree to it. I want to show our viewers this, Heather, because we have a lot of the graphs that you just showed us on our website right now. So if you go to azfamily.com, you have to go to the main coronavirus area, and then you'll find these tabs right across the top here, and each tab will bring you to a new section, and many of them show the different charts. Here's our main dashboard, constantly updated with the new numbers. Here are some of the charts that Heather just showed. These are the cases in the ER. These are the intubations she was talking about, the number of people going on ventilators going up every day. And you can also do a deep dive into the economic side of this, the unemployment claims, unbelievable numbers. It's all posted right now on azfamily.com.